Friends and loved ones forsake you. All you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover. We learn to discover. We observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you. I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research. No need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show. It will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air. Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James. Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover. We learn to discover. We observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you. I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research. No need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show. It will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air. Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.
Hi, thank you very much for joining us here on the Discovery Show. Here we say Yearn to Learn. This is a show that seeks to interview professionals in the diaspora and beyond who are making significant impacts in the area of healthcare, politics, religion, academia, and what have you. My name is Precious Adadidiodu, ably produced by James Kwabena Opon. This evening, I'm joined by two very wonderful men, and we're going to have a very wonderful discussion. Very briefly, they're going to introduce themselves, but we're just going to talk about fostering effective nurse-doctor relationships towards improved patient health outcomes, and to a larger extent, fostering working relationships among healthcare professionals in the healthcare setting across the globe. Perhaps today we might zone in on Ghana and also in the UK just to draw on some experiences. But very briefly, I want to invite my guests to introduce themselves. Please go for it, Emmanuel.
Good evening. Good evening, everyone. My name is Emmanuel Prah. I'm a registered nurse. I had my training in Ghana. I worked in Ghana for some years. Then I had the opportunity to come to the United Kingdom, where I'm currently working as a nurse as well, in one of the medical hospitals. Yeah, so briefly, that is what I can say about myself. Yeah.
Brilliant. Go for it, Dr. Ackerson.
Oh yes, Precious. It's always a pleasure to be talking to you and to be on your platform. My name is Dr. Ackerson, Anthony Ackerson. I also train in Ghana, just like Ima. Maybe our path might have crossed one way or another. The face looks like someone I've met before.
Oh, really?
Yeah, so I trained in Ghana. I did my house job with the military hospital, 37 military hospital, and Tema General Hospital. That's where I did my second year. And right after that, circumstances, brought me here to England. So I had to quickly fit into the English system. So I joined training as an F2. Here in Leeds, the Leeds General Infirmary. So, and after that, I was lucky to be selected into training. So I'm currently in surgical training. So I'm with the TNO department here at LGI. So that's a little about me. Yeah.
Thank you very much, gentlemen. Really, really grateful that you could make it within a short period of time when I just had to inform you about this. Really grateful. So, if you're watching us, perhaps you might be a healthcare professional or not, but within the healthcare setting, the ultimate priority is to provide healthcare to our patient or client in general. And as humans, sometimes communication and human factors might cause some sort of fracas or challenges within the healthcare setting. So, from the aviation sector, there was something that we all have learned, which is called human factors. And we have both personal and also systemic human factors as well. For example, stress, communication, these are personal issues. And of course, when you come to the systemic problems, things like standard operating procedures, they can cause some sort of challenges and to an extent impede the sort of work healthcare professionals might have to do. You might be wondering, why is this guy talking about this? There is a current issue that has happened in Ghana within the healthcare setting, and we want to leverage that conversation for today's discussion. So if you are new to it, or if you know about it, but perhaps you want to be up to speed with that, there was a sort of an incident in one healthcare setting in Ghana. I don't want to put names to all these, settings, because that's not the focus of our discussion. Where a nurse and a house officer, so when we talk about a house officer, a doctor who has completed 6 or 7 years of training and will have to do some 2 years of sort of transitioning from being a student to a full-time doctor. And there was some sort of communication which perhaps went wrong. And then the doctor had to bring in the father. So there has been some institutions, organizations that back these individuals that have released some press statements. And I want to go through that so that at least we have the facts laid bare before us. So there was a voice recording of a male who purportedly was the father of the house officer, who is a lady. And basically, that went wrong. There was some insult, very strong words in there. At the end of the day, Ghana Registered Nurses and Midwives Association, who actually are the parent association for the nurse, had to come out to the press release stating that the individual in question, who was actually a regional director for a national service scheme, had to be sacked within 72 hours. And the incident actually happened Sunday, 27th of November. So the scheme had actually given 72 hours ultimatum so that the man could be sacked. Of course, if you look at the press statement, some of the issues they raised were the fact that the man in question actually failed to follow procedure. There was a nurse manager, there was also a medical superintendent who actually could be contacted for the issue to be actually investigated. And as a result of this, the nurses organization or association had called for an industrial strike. And that was going to be more of a stepwise strike. They were going to start from that particular institution. And if the appointing authority wasn't doing anything about that, it was going to the regional level. If nothing was done, it was going to the national level. So that was about that. And they had also called for their hospital in question to school the house officer about her responsibilities within the medical team. So, of course, one issue they really highlight was the fact that nurses are patient advocates. And this is something I want to really clarify from here. The nurse had actually used a phone and call credit to call the house officer in question to come to the hospital and log into the e-health system and update the patient's prescription order so that the patient is not billed for unissued drugs. I know on social media there's been some account of a wrong prescription, which is not the case. And the General Ghana Registered Nurses and Midwives Association make it very clear that it wasn't any issue of that. It had to do with the doctor coming to log into the e-health system so that the patient was not billed for unissued drug. So ultimately, they called for the hospital to also promulgate some sort of team building and teamwork to foster unity of purpose. Then comes the Junior Doctors Association of Ghana, who also had to release a press statement and saying that the doctor did not review any child on the surgical ward on the day in question because, of course, on social media, that issue was purported. And there was no prescription written for a child. So that means that there wasn't going to be any wrong, dosage as was purported again. And the whole idea was that the doctor had correctly prescribed an intravenous fluid for an adult patient on the surgical ward. Again, the Junior Doctors Association corroborates what the Ghana Registered Nurses and Midwives Association has said, that the non-availability of the intravenous fluid prescribed prompted the nurse to call the house officer to delete it from the system to avoid extra billing. So it looks like the two associations are on the same level.
Yeah.
So I spoke about the issue of human factors, communication, and I think this is where the whole problem starts. So they were all patient advocates, they were all on the same level, but it had to do with communication, and that is what I really want us to focus on. So ultimately, the National Service Scheme had to suspend the regional director in question pending further investigation. But remember that from the Ghana Registered and Nurses and Midwives Association, they had given a 72-hour ultimatum that the boss needs to be fired and not suspended. And because of that, they had, of course, yesterday issued a statement to say that from today, which is Friday, 2nd December, the people in that particular institution or hospital were supposed to go on strike. And Tuesday, 6th December, if the man was still at post or wasn't fired or sacked, then it was going to the regional level. And then on Friday, 9th of December, if the man wasn't fired, then of course it was going to be a nationwide strike for nurses and midwives. And then today, the same Ghana Registered Nurses and Midwives Association has come back to say that the Ministry of Health and Ghana Health Services actually reached out to them in writing to also condemn the action of the man in question, and they've called for calm and also withdrawal of the industrial strike. So ultimately, these are the facts, laid bare before us. There's been a lot of argument, a lot of ideas going on, but I guess this sets the stage for our conversation. And if you are new to this whole thing, I want to believe I've done my best to summarize everything that has been going on. So I want to start the conversation with you, Emmanuel. You worked in Ghana for some time. I just want to take your thought on this. Again, this is a solution-oriented discussion. We are not seeking to apportion blame to anyone. But what are your initial comments about the whole situation? What are your thoughts? What do you pick from it?
Thank you very much once again, Precious. Personally, to me, I believe that this incident is quite an unfortunate one. It shouldn't have occurred in the first place. You know, I personally believe it's an insult to our health system, to all professionals involved, to nurses, to midwives, to doctors, to all health personnel as well. This should not have happened in the first place. Okay, I'm not here to apportion blames as well. Whatever that ensued for such an incident to escalate to such an extent should have been dealt with separately in the first place. However, what I would like to say is actions like this have consequences. It has a lot of effects. An effect is what we are seeing at Surrey Hospital now. Now, nurses are on strike, and it's patients who are the receiving end. Patients are the ones who are now suffering to the extent that they have to discharge some patient home. I was watching a video today, and I saw one lady who had been amputated, and the lady has been told to go home because nurses are not there to take care of the patient. And we also have to understand that this is not an isolated case. We've seen quite a lot of these cases. Back home when I was in Ghana, we had an incident where a mob had to come to the hospital, come and attack nurses and midwives because there was some issue like that. I think it was an issue with a baby. I don't want to go back into much more details. So for me personally, I believe it shouldn't have happened. And going forward, we have to put in measures, strategies in place so that we don't experience such a thing before, because clearly speaking, it does not foster the public interest, or what do you call it, confidence in our health personnel. If health personnel are being talked to in this manner, if somebody can just have the effrontery enter into the hospital, rain insult on people, I mean, what is it telling people? It means that anybody can just stand and go into the hospital and do what has happened. You know, it shouldn't be encouraged. It's a shameful incident to me, and I believe that we should find ways and means to prevent it from happening. As I said earlier on, it's not a single case. Most of the sectors in our economy, in our country, they are facing these problems. I remember when I was in primary school, we had incidences where parents will come into the school, come and insult teachers. Sometimes they can go to the extent of even physically abusing them just because the parent or the student was corrected by the teacher. You know, it's not something that is only peculiar to the health sector. It is happening everywhere. And I believe it's high time that we stand and take measures against this. Maybe this case has happened so that we can have an eye opener, throw more light on it, and so that the government and other stakeholders who are involved will all help so that we prevent such an incident from happening. Yeah.
Thank you very much, Emmanuel. And Tony, yeah, go for it.
Oh yes, I mean, Emmanuel, I've said everything. It's embarrassing. I mean, me as a doctor, I'm totally scandalized that such a thing should occur. You know, especially when the incident occurred, or the event that we are talking about, the father of a house officer walking into a hospital. If it had happened on the blind side of the doctor, I would have pardoned her for it. But you realize that on the audio, the doctor was there, you know, with the dad, and that was scandalizing. I couldn't believe it, that you couldn't, first of all, restrain your dad from coming to the hospital, and you are there, and in your presence, your father is verbally abusing your colleague, and you're also making contributions to it and all of that. It was totally embarrassing. I mean, it's something that shouldn't have happened. You know, it doesn't speak well of our training, you know.
Yes.
as professionals. I mean, we have to conduct ourselves in a certain, you know, manner as professionals, the professionals that we are. And you know, for such an incident to occur, I was totally embarrassed and totally scandalized. I mean, as doctors, and I can speak for doctors, I mean, as doctors, we are trained to take up leadership, you know, in the medical team. And if an incident occurs, or if a situation arises and you are not able to apply some of these, you know, leadership skills and leadership principles to resolve them, and it has to come down to this level, then it doesn't speak well of your training as a doctor. And for me, it's I mean, like, just like Ima said, it's something that shouldn't have happened in the first place at all. And now look at the ramifications. Look at what is happening in the hospital. You know, the whole working environment and the whole camaraderie between doctors and nurses. You know, it poisons the whole environment. It makes the whole hospital, you know, I mean, you know, healing is a spiritual thing. It's not just the medicines that we give that gives healing. So if the whole environment is chaotic, you know, then the whole process of us ensuring that people, you know, people have their, sorry, my child has walked into the room, so I'm sorry about that.
It's allowed.
Yeah, so I mean, it's poisoning the whole working environment, and it's so shameful, to say the least. It's so shameful. I couldn't believe that a doctor fully trained at that, you know. And this is a senior house officer. This is not like some junior who has just come out of school. This is somebody who has done first year somewhere else. Because I believe Mainshare is a second year place. Yeah, Mainshare should be a second year in a hospital. So this is somebody who has had some experience of the clinical environment. So things like this shouldn't result in you bringing a parent and, you know, ending up this way. Totally embarrassing and precious. I mean, the Ghana Health Service delivery system is better than this, isn't it? We're all there. I mean, it's better than this. Come on, this is like one of the lowest ends of our healthcare system, isn't it? Very, very shameful. Yeah.
Thank you very much, Dr. Ackerson. In fact, you all make very valid points. And like I said, the whole idea is to make it a very solution-oriented point.
Yes.
I mean, the release by the Junior Doctors Association of Ghana on 29th of November makes a very important point, which I want us to look at and explore how truthful that is and where we can pick the pieces. They make the point that doctors and nurses have always had a peaceful collaboration, and we will continue to work as a team to provide quality healthcare to clients and Ghanaians. Doctors and nurses have always had a peaceful collaboration. I just want to pick your thought. Where is this situation? I mean, is this particular point very valid? Is that the case? If not, where are the challenges really? What are the causes of the challenges or the issues we have, that sort of friction we have, if there is, in our healthcare system? I want us to diagnose the issues first of all, and then we can look at the solution and how we can leverage our current experiences to help our healthcare system. So, Emmanuel, what are the sources of the problems? Where do we have those problems coming from back home, if there is any?
All right, thank you. So when I was in Ghana, I worked at a regional hospital in Koforidua, and I would say that the structures there, how we used to work at the regional hospital, when I migrated to the United Kingdom, personally, I didn't find a lot of challenges because what we were doing there was quite similar to what we were doing in the hospital here. It's just that there were some specialties we had there that we were not having here. Irrespective of that, I really found out that what I realized was that when I was there, there were times that I felt that my contribution as a nurse was not that much picked, or was not that much respected. Let me put it that way. In the essence that it was just that a nurse, you just have to execute the plans by the doctor. That is what you have to follow. You can't question a doctor. I don't know if systems have changed now, but that is what I felt. Okay, I felt that communication-wise, our opinions were not much taken. It's just a doctor who is doing most of the things, and we are told to just execute their plans. So I believe that the system in the communication aspect is really lacking. Okay, we don't communicate much well with our doctors. Okay, the plans that the doctors want us to do, we just follow the plans, but we don't ask questions. We even if we speak up, sometimes our voices or our views as nurses are not being heard. Now let's look at another instance, another example. For example, let's say you work in a rural area, you work in a remote area. There is no doctor, there is no midwife. It's just a nurse there. The nurse is acting as a doctor. The nurse is acting as a midwife. The nurse is acting as everything. So there is this role conflict here. You are not performing your role. You are doing someone else's role. So in the case when they bring a doctor and the doctor starts executing his roles, then the role conflict begins. I'm supposed to do this. Why is the doctor doing that? Why is the doctor doing this? So our role as well, we have to respect our roles. Sometimes we don't clearly follow our role path, and sometimes it leads to problems too. So personally, I believe the communication, the role, always create conflict between nurses and midwives. Yeah. And the doctors as well. Yeah.
Thank you very much, Emmanuel. Yeah, Tony. Sorry, you are muted. Okay.
Yes. Emmanuel has craftily, pushed the blame on doctors, isn't it?
No, I'm not putting.
Remember, no blame. Today, yeah.
It's just from my experience.
Yeah, he makes a good point. I mean, he makes a good point. Precious, you see, like we always say, to get a patient from the sick bed into being healthy, requires that a lot of people make contributions. Okay. So we always talk about, we are forming a healthcare team, it's a healthcare team. And so, first of all, we need to understand what this team is and accept the dynamics that exist in the team. Okay. So you have a nurse, you have a doctor, you have the medical lab scientist, you have the the sonographer, the X-ray technicians. All these people make contributions into the care of the patient. So we need to understand that even though my input as a nurse or as a sonographer is not being seen, or the patient is not recognizing my input, you understand that you are making an input. Okay. The reason most people think that, oh, it's the doctors that are taking the shine, it's the doctors that are getting all the plaudits, is because for some reason within the healthcare team, it is the doctor that is allowed to plug the flag. And to plug the flag means is the doctor who is allowed, for some reason in our setting in Ghana, is the doctor that is allowed to make a decision. Okay, is the doctor that is allowed, is the only member of the healthcare team that is allowed to make a diagnosis, for example. You see, a nurse can have an idea of what is happening to this patient. Okay, they can bring in a person and a nurse who knows that, oh, this is a hemorrhagic stroke. Then a nurse may have an idea, oh, this is this. But is the doctor that is allowed to plug the flag and say, okay, this is it, and this is the actions, or these are the things that we need to do. Like Ima said, it's like the nurses are only executing the plans of the doctors. But you need to understand that you are part of the team, and the team has to usually have a leader, kind of somebody who spearheads it, So the roles, like he said, has to be clear cut, so that a nurse knows that this is what I'm doing. This is my contribution in the team. But let's make all these contributions and make it look as if it is the doctor that is doing everything. You see, and that is what a lot of our nurses don't want to see. But unfortunately, from the days of Hippocrates, it has always been like that. That the doctor is the one that is allowed to plug the flag and take the decision. You see, so one of the things that is generating a lot of the rift between the doctors and nurses is the issue of, oh, the doctors are taking too much of the plaudits, the doctors are taking too much of the credit. You understand that? The nurses feel like their job is not being appreciated, their input is not being appreciated.
Do you think that is the case? Because of course, I know you have a close relation who is a nurse as well. Do you feel the same?
Well, yeah. I mean, nurses to a large extent feel like they are not being recognized within the healthcare team. It seems they are doing the low-end jobs, for the patients. They are attending the patients. They are, cleaning them up and all that. So they feel like they are not making a valuable contribution. But it's not the case. They should understand that the team has somebody that is, is supposed to spearhead it. Somebody who is supposed to take responsibility of all the contributions that other members make. The doctor is supposed to take the responsibility, of the patient and ensure that the patient's outcome, is the best, or is of the best interest. So, the problem that which makes, the issue that brings about a lot of the rift between a doctor and the nurse is usually because of who is getting the praise, who's getting the shine and all of that. I think that those ones, as a nurse, you should be able to understand it. That's how it is. You see, there are people in the Flagstaff House in Ghana who are making a lot of input into governance, but you don't see them. You only see maybe the president or the vice president, but there are people who are behind the scenes, who are pushing very important buttons and getting things done. So we all need to understand that this is the team that we formed. There's leadership, there's hierarchy in it. Recently, I heard a nurse say that, oh, nurses don't work under anybody. Nurses are independent members of the healthcare team. It is true they are independent, but if we have a sick patient on the bed right now, we form a team, and the team must have a leader, and the leader is a doctor, or in some cases, the dentist. Okay, so we need to accept it. Okay, I think that to a large extent, a lot of nurses don't want to accept their role. Accept their role, okay, and don't conflate it with that of the doctor. If that understanding comes to exist between the doctor and the nurse, you see that the work environment will be very cordial, and we all know what our roles are, and we'll perform them. As for the professional relationship, it's mutual. It's about mutual respect, isn't it? You cannot disrespect. You cannot be a senior doctor and disrespect a junior nurse, or you cannot be a senior nurse and disrespect a junior doctor. You know, that junior senior thing shouldn't come to play when it comes to professional relationships. So
all right,
for me, I think that the main thing is accept your role and understand that there's hierarchy. Okay, and play your role to the best of your ability. Don't forget about the shine. Forget about who is getting, the plaudits and whose face is on it. Nurses make important contributions. I mean, fantastic. I mean, so some of you, guys, look at what you are doing. I mean, Ima, Precious, and I know a quarter of you who are brilliant people, very, very brilliant, and I respect you. So you need to understand that this is the role you are playing. And it's part of the team, and the team has a leader, and is a doctor or a dentist.
Yeah.
For me, let's understand our roles, and all these rifts, to a large extent, will be dealt away with.
Thank you very much. Dear viewers, as you can see on the screen, we want to hear from you, especially if you are a nurse, a doctor, any other healthcare professional. You could be a medical lab technician, anybody. Please join the conversation using the link in the chat and on the screen. We want to hear from you. In due course, I can see those at the backstage. I'll add you to the stream so that you can share your experiences. But of course, in qualitative research, there's something we call reflexivity. That is the researcher's subjectivity. As Tony said, I am a trained nurse and I have close relations who are also doctors. So I just wanted to declare that so that at least it doesn't seem like I am being biased. As much as possible, how I'm going to control that is to limit what I'm going to say and allow our guests to speak. So that is how I'm going to control my own biases. So I think it was important I leverage that concept to explain who I am, my background, so you don't feel that
you had to put in that disclaimer.
Yeah, very, very important. So just before we move to the solution, because that is really the focus of this discussion, there's some sort of conversation on the internet. For example, I did say that the Ghana Registered Nurses and Midwives Association had declared strike, which actually started today. And I know there are a group of people who are vehemently against that, okay? Others are also very excited about that. And my question really is, where do we strike the balance between protecting the integrity of a profession and also considering the health of the public? Others also make the argument that the association was seeking for, a sack for the director in question. However, if that was going to be an instant sack, there was a possibility for a judgment death. There was a need for that due process to take place so that they listen to the man and all that. So I guess the question I'm asking really is that where does a professional association strike the balance between protecting its members, the integrity of the profession, and also still providing that sort of care that the public needs? So I'll take your thoughts, Tony, if that's okay. Let me start with you this time.
Yeah, so it's for a professional organizer, for a union, let's say it's always about the members, isn't it? So like I was telling someone that in this situation, the unions will have some actions to take, and then the regulatory body also has some actions to take. So you take the action that has been taken by the union, the GNRNMA, isn't it?
GNRNMA,
so, yes. It's right that they come and to the support of their member and provide that kind of backing for the nurse that was clearly verbally assaulted in that audio. And now they are demanding the head of the father of this house officer that we are talking about. So just like you asked, where do you want to get some justice, and you also want to deal with the issue. So the union says that they want the man sacked, and government says, okay, you want the man sacked, allow us to take the man through due process. So now he's been asked to step aside, and undergo some administrative processes to come to a conclusion as to the propriety of whether he should be sacked or not. So for me, I think that it was a good call from the union. It tells you that this is a very strong union, and they know what they are talking about, because I mean, this was somebody who who walked into a hospital and assaulted a member of the union. So, you know, if it's well in their right to demand for the man to be sacked. But I think that they should also listen to, you know, what government is doing, because, you know, if you want justice, then you need to go through the process that, you know, delivers justice. So allow the process that delivers justice to go on, and, you know, then we get, you know, the both sides all satisfied. You know, so I think that the strike, if they are minded to call it off, I think that should be something that we welcome. I don't know if they are minded to call it off anyway, but if they want to call it off, that's something that we welcome, because, I mean, we've set you know, in motion the process that delivers justice. So let's allow the man to face his administrative processes, and hopefully, if it turns out that he grossly misconducted himself in this situation, it's all right to let him go. I mean, what he did in the audio was totally unpardonable. I mean, but we are looking at somebody who also puts food on the table of a family, so they will try to balance, you know, sacking him, getting him some administrative sanctions and all of that. So for me, the union is a good call. It's well within their right to ask for his sack, but allow the process to go on. Let the man face the panel, let him go through the process, and in the end, justice will be served.
All right. Thank you very much. Emmanuel, what do you think?
Yes, I clearly and I agree with Tony concerning this. You know, we can all see that this act is a condemnable act. You know,
Absolutely.
clearly stated, emphasized in the first place. It should not have happened. So definitely, for someone who is a public officer, let me put it that way, someone who holds a regional position, to behave that way, it doesn't speak much well of that person, and also the individuals that are involved. JRNMA, I would say they have acted swiftly, and it is their duty as an association to protect their members. And clearly, I believe it's the right way that they are going. It's just that I believe that they should follow the due process. They should allow the investigations to actually happen. I just read that they have currently suspended the strike that they intended to go, because some people have been speaking with them, and I think it's the right way. We have to set up an investigation for them to do the investigation process and bring us the outcome. So it's the right way. The association is right to protect its members, but we have to allow the investigative bodies to actually do their investigations. Otherwise, the innocent patients, we should put them at the back of our minds. You know, it's really sad concerning what is happening to that patient. In as much as we are condemning what has happened, we should also have some pity as well. Yeah.
Thank you very much, Emmanuel. If you just joined us, dear viewer, this is the Discovery Show TDS TV here on YouTube, Facebook. I'm speaking to Mr. Emmanuel Prah. He actually trained and practiced in Ghana as a nurse. Currently, he works as a charge nurse at the Surrey Hospital here in UK. And also Dr. Anthony Ackerson, who trained and practiced in Ghana as a medical doctor. Currently, he works at the Leeds General Infirmary, also here in the UK. My name is Precious Adadidiodu, ably produced by James Kwabena Opom. And we're talking about fostering effective nurse-doctor relationships towards improved patient health outcomes. They are the receiving end. So if you're wondering what exactly is this about, there has been a fracas in Ghana within a healthcare setting, and we are exploring what the challenges are. We are not actually laying accusations at anyone's doorsteps. What we are doing is that, because all the panelists here have actually worked in the Ghanaian setting, we want to know what the real issues are, especially within the multidisciplinary team. We want to actually note that, and then we are now going to move to the second bit, which is about proffering solutions for our healthcare system. So that is the main focus of the discussion. So if you just join us in the middle of the conversation, don't see it as an accusatory conversation. And also, of course, feel free to disagree with whatever any guests have said. It's the beauty of the game. But most importantly, if you're a healthcare professional and would like to contribute to this conversation, please join using the link in the chat or on the screen, and I'll kindly admit you to this stream. So I'm going to admit Josephine. Josephine Amwa is actually, hello, Josephine, can you hear us? Hi, Josie.
Can you hear me now?
Hi, I can hear you now. You're welcome.
Yeah. Thank you. Sorry, I'm swimming lessons with my son, so it's a bit noisy and I can't have my camera on.
I should say Josephine is actually a Band 7 nurse here in the UK, originally from Ghana, but based here in the UK. Go for it, Josephine.
Thanks, friends. Thanks, guys, for the conversation. I think it's well needed. Now, one of the things that I wanted to put across, I think I agree with what Dr. Ackerman said to some extent, that, you know, the doctors are the leaders of the MPT in the case of looking after a patient. But there's also, I think I kind of understand where the nurses are coming from, in the sense that it's always been said that nurses are the maids of doctors. That's how the society sees us, all right? I mean, let's not sugarcoat it. That's how it is. That's what everybody thinks, that we do the bidding of the doctors. Now, it's up to us to change that narrative, but we cannot do that when we don't get the respect that we actually deserve, because it's always been, oh, the nurses are doing what the doctors are asking. But obviously, nurses, we are part of the MDT, but we are also independent, autonomous. I think Dr. Ackerman mentioned something about nurses being independent and whatnot. I'm an independent nurse. I work autonomously. You understand? So nurses are not all bedside nurses. And I think we have to shift that mindset that, you know, nursing is not just bedside nursing. There's so much to nursing, if you get what I mean. So yes, nurses can be independent. Yes, nurses can be autonomous in their practice. But the thing is that because nurses have always not had the respect that we feel we deserve, I think when anything like this happens, we kind of like blow things out of proportion, because we've been stifled for so long. All right. Now, I never trained in Ghana. I never practiced in Ghana, so I cannot talk from a Ghanaian perspective. But if you know what is going on in the UK, nurses are striking because for so long we've been undermined, we've been underappreciated and whatnot. Right. So that's the one point. The second point is that the GRNA, I think the decision is a bit excessive. All right. Because sometimes when something happens, your reaction to whatever happens has to be proportionate. And the fact that they are proposing or they've started to strike is a no-no. All right. Because at the end of the day, it's the patients that suffer. It's always the patients. We have to always think about our patients. They are the reason why we do what we do. So, okay, we are angry. Okay, we are, pissed off. We want to do that. We want to kind of appease the nurses and let them know that, the GNRA is doing what they're supposed to be doing in protecting the nurse and the nurse title. But we have to also be conscious of what those kind of decisions that we make, the kind of effect it has on patient care. All right. So I'm all for, the GRNA standing up for nurses, but whether or not it's okay for them to strike and put patients at risk, that for me is a no-no. I do not agree with that. I'm sure there are many, many other ways that, the union and other unions, other nursing and midwifery unions in Ghana can go about resolving this issue. But as for striking, I do not agree with that. That's all I've got to say.
Thank you so much, Mrs. Josephine Athamwa. Josephine is an infection control specialist nurse at Band 7, and she works with clinical commissioning groups here in the UK. And of course, we've interviewed her on this platform before. So thanks so much, Josephine, for coming through. And we really appreciate that. Okay. Despite where you are, you still managed to join. We're grateful. All right, speak to you sometime. Thank you. But of course, before you go, what do you think, in a minute or two, what are the solutions for you? You said you never worked in Ghana, but what are the positives for you here in the UK system you think we can learn back home?
I think the fact that we have voices here. I'm not saying that we've never been abused. I mean, I've been slapped by a dementia patient that gave me a headache for one day. You understand? It happens. But I think it's the fact that for example, here, when some of these things happen, like you're being abused by a patient, sometimes nothing gets done. I'm not saying that's right, but what I'm saying is that things happen. Now, this particular gentleman in the Ghanaian case, for somebody of his caliber, that was a big no-no. I mean, he's kind of overstepped his boundary. But the thing that I feel like nursing unions can learn from the UK, how things are done, I think it's just more about giving that nurses the respect, the autonomy, and kind of supporting them just like they're doing. But I feel like the GNRA is not supporting the nurses the way they need to, because in doing so, they are putting their patients at risk. So I think it's more about respecting and supporting, and I think kind of like laying it out and letting other members of the MDT know that we are all part of a big puzzle. You understand? Everybody, without doctors, we cannot look. We cannot do our jobs, and without nurses, doctors cannot do their jobs. Without porters or without cleaners, the hospital will be very dirty, and that will increase the incidence of infections. So everybody, regardless of how low their grading is in the hospital, is important to the effective running of a hospital or a care organization. So I think it's about getting that respect and getting that voice out there and getting that message out there that everybody is important, regardless of your grade, regardless of your qualifications or whatever. As long as you're providing that care that a patient needs, that's all that matters. And we all have to kind of embrace each other, give that respect to ourselves. Because if we don't respect ourselves, the patients won't respect us. Full stop. You understand? So it's like charity begins at home. We have to do our own stuff in our homes before we, i.e., our hospitals, before we get the patients and the public to respect us as much as we want.
Thank you so much, Josephine. We are happy you came through with your thought. Thank you. Speak to you later. All right. So, Emmanuel, I'll give you 5 minutes. Tell us what you think we can learn from your current experience here in the UK. So, I guess we are going back to the main theme, fostering effective nurse-doctor relationship towards improved patient health outcomes. What have you learned from this system here in the UK that you think we can learn back home? Of course, it might not be a one-day thing, but progressively, what can we learn so that our focus will be fostering that great relationship and also at the end of the day, improving the health outcomes of our patient? Take 5 minutes to share your thought.
Oh, I've learned quite a lot. I think 5 minutes is not enough. But anyways, I'm going to summarize it. One positive thing I've learned here in the UK is teamwork. Every member of the health professional is respected here. We consider ourselves as a team. We don't see somebody as important than the other. The doctor, the nurse, the therapist, the cleaner, we see ourselves all as equal. When there is teamwork, we all move in unison. When teamwork is fostered here, communication is well laid or communicated to people. We know what we are doing. One person does not do the other, and the other person come and do different things. Okay, there's this teamwork. We work together. So at the end, there is patient safety. Patient safety is what is assured. That is one positive thing I've seen here. Also, here in the UK, we have what we called we have the electronic prescribing system. I think they have it there as well. But I don't know why it had to be that same doctor who had to come and change that prescription, okay, who had to come and make that correction or whatever happened there. Here we have doctors who carry blips around. There's a different doctor every time. It doesn't mean the doctor who is taking care of you will be the same pet doctor at the hospital who will take care of you. For instance, with this incident that occurred, if it had happened here, the nurse could have easily called a different doctor to come and make that correction. I don't know how that system is working there, that the same doctor would have to come in and make that changes. Okay, I think we have to streamline the electronic system that they have there, that doctors can have access to it and make changes in case the doctor is out of hours. Just look at what the nurse did. He used his own phone to call the doctor on his phone. Something I believe is not right. Okay, there should be a doctor around, an on-call doctor around who can easily do that just to make the work easier. If it had happened, this incident would not have occurred. Also, there is what we call mandatory trainings that we have here in the UK. Trainings that deals with patient relationship, trainings that deals with our skills and stuff, communicating skills. These are all trainings that we undertake that streamlines us, that shapes us in our profession. I believe that in Ghana there are workshops as well, but we should invest more times in training, especially teamwork for nurses and doctors back then. And one thing that I really, when I was reflecting on this incident that has happened, is about the security in the hospital. I just said to myself, just look at how the man got access to the hospital. He just entered into the hospital. What if he had gone in there to actually Maybe he had, I'm not saying it would have happened, but he had a gun, he had a knife on him, something like that. He would have just committed a murder and had left. So we also have to look at our security system in our hospital. We have to invest in the security system. You can't just walk into the hospital just like that, okay, and come and do whatever that you want. Somebody should be there to do some checks and balances before we allow you into the hospital premises. Security is something that we don't joke with here in the hospital at all. And also, there should be respect among colleagues. Okay, the kind of respect that is apportioned to everybody here should be equally equal. We should have mutual respect within us. How we communicate with people, how we see people, it really matters. You shouldn't look down upon somebody, especially in the health system, based on the country that they are coming from, their qualification, the years that they spend, or their experiences. We shouldn't do all those things. And the last that I want to touch on is about complaint system. I don't know if we have complaint systems in our hospital back home, but here, every hospital have what we call the PALS. I don't know. It's not just restricted to patient only. When you are not happy with the treatment that you have received or your patient has received as well, you can go there. It's an investigation body. You divert your, you send your complaints there, and they do investigation and then give you a feedback. We can't just skip the hierarchy, or we can't just skip how things are supposed to be done and take the law into our own system. So we should have a complaint system in place in our hospitals so that grievances like this can be dealt with, and this incidents like this won't happen. Thank you.
Thank you, Emmanuel. You raised some very fundamental issues. Thank you so much. I'll make my comment at the end of it. Yeah, Ackerson, go for it.
Yeah, I mean, you might have spoken so well, I mean, like as things like PALS, it's not so emphasized in Ghana. For example, if somebody walks into a hospital and says, I want to make a complaint, here in the UK, they'll tell you, oh, okay, if you want to make a complaint, this is how you go about it. They actually give you information. They will signpost you to what to do to file, make an official complaint and all of that. So very important that you must raise those issues. These are things that we should all, I always tell my friends, especially those who are practicing back home, that when you come to the UK, you realize that there's some level of clinical excellence that you just cannot deny. The way the clinical excellence is so embedded in everything that they do in this place. I mean, a colleague of mine recently started GP training in Crewe, and he was just jumping. He was just jumping to the skies. He calls me every day. Charlie, Tony, the things they do here, Charlie, you go bust your mind. You go. I'm like, take your time, take it. You realize that the system has excellence embedded in it. So these are some of the things that we should take up into our practice in Ghana. But back to the issue of fostering relationship between nurses and doctors to ensure that the patient gets the best. Recently, I saw a picture where it's like a poster where they put the lead consultant's picture and under it they write head of surgery, and then they put the picture of the ward sister and says she runs the show. It's something that I saw circulating in our in our groups. So it's all about recognition. That's something that is so clear anytime you walk into any NHS trust. Everybody is recognized. Everybody is recognized. Yes, when it comes to responsibilities, yes, we are all apportioning our responsibilities, but within the team, there is absolute recognition of everybody's contribution. That you cannot deny. It's absolutely, something that will always catch you when you enter any NHS trust. So it's something that between nurses and doctors, we should know that we should recognize. I mean, there should be that level of recognition, and I realized that the more you grow in the profession, the more you become a senior, in this medical profession, then you realize what relationships can do for you, and how, your profession, I mean, even beyond professional relationship, personal relationship can do for you in the working environment. This is what we should be doing. As a doctor, for me, what I can say is that take responsibility as a doctor in a hospital to ensure that nobody feels belittled, nobody feels that their contribution, is not being recognized. So give them the utmost respect and recognize them. I mean, mutual respect is what will carry all of us through. Here in the UK, it's so. I mean, you can mistake an F1 doctor for a consultant, because of the relationship and the kind of sorry. There's some background noise in here.
It's allowed. It's allowed.
Yeah, it's okay. You can mistake, like I was saying, you can mistake an FY doctor for a consultant because the recognition is there. Nobody. If they don't tell you this guy's an F1 doctor, you might think he's some senior, because everybody is recognized, and the respect is there. Until until you're told that this person has this position, you cannot tell the difference, and that should be it. And that should be enough to make the environment conducive, to make us, give up our best for our patients. It's all about respect. It's all about recognizing the contribution of your colleagues within the team. For me, it's nothing like that. Yeah, it's about knowing that, look, what the nurses are doing is great. What the doctors are doing is great. What the lab guys are doing is great. And we all put it together and help the patient. For me, that's what it comes down to, Precious. That's what it comes down to.
Thank you very much, Dr. Anthony Ackerson, and also Mr. Emmanuel Prah. Emmanuel is a charge nurse at the East Surrey Hospital here in the UK, and then Tony also works at Leeds General Infirmary, also here in the UK, as a medical doctor. And of course, you raise very fundamental issues. And if I have to summarize that, you spoke about challenges with our complaint system. If we need to raise any concerns in the healthcare system, how effective is our system? We always know that there are shift in charge, ward in charges as nurses, all the way to the chief nursing officer, director of nursing services, and all that. But how effective is that system? That is another thing. Is there any other system, robust system of raising complaints, especially within the multidisciplinary team? I think that's something very simple thing that we can do as well. Secondly, you also, and of course, as doctors, you also have your own hierarchies as well. You have your medical soups all the way to who mostly will be the head of the hospital or CEO in teaching hospitals. So, of course, we need to strengthen our complaint system as well. And then Emmanuel raised an issue about healthcare staffing. You asked that, how could the nurse call the doctor? Was there not any other doctor on shift to really rectify that? And again, it comes back to our policymakers, our government, and people who have the power to recruit more healthcare professionals, isn't it? Recently, there were over, I think, if I'm right, a number of doctors, over hundreds of doctors who were sitting at home and awaiting clearance. It's always been a yearly thing. Nurses who are home and need clearance to work. So obviously there's a problem with healthcare staffing. It's not that we don't need them. We need them. And secondly, like I said, I have a close relation who is a doctor, and having worked in the system, I know the sort of, and Dr. Ackerson will definitely corroborate with this. I know the sort of workload for house officers as well. So even whilst they are away at home, sometimes they'll be working from home, so to speak. Because you have patients you have to take care of all throughout, because your bosses have literally given the work to do. So that's something we need to really have a look at. It's something we need to have a look at, because of course it's a lot of work for them. And of course, when we come to the nursing level, a lot of work, a lot of patients to take care of, that sort of frustration. These are basic things we can do to reduce the workload on healthcare professionals. And it ties in with what I have said from the beginning. Human factors. Once the workload is too high, there's stress, and that is a personal factor that results in easily becoming angry, easily fighting the other member of the healthcare team, easily just throwing patients off. It is a big problem. It's a very big problem in a healthcare system. The stress is too much, and sometimes people even go to the extent of becoming negligent. So I think these are fundamental issues that our healthcare system will have to tackle. And again, you all agree to the issue of mutual respect. Recently, I averted my mind to this whole thing again. And in my current role, we were reminded of the fundamental British values. Fundamental British values. And they spoke about four things: democracy, rule of law, individual liberty and human rights, and then finally, mutual respect and tolerance. And for anyone watching, that is where it doesn't matter who you are in this system, even if you are a cleaner and you are the head of the hospital, the respect is mutual. You don't need to, be in a system of classism. That is basically what we do back home in Ghana. And so for people to feel respected, it's like you need to have a status before you are respected. And that is the issue. And it plays out clearly in this video. Do you know who I am? I am this, that, I'm that. You are a nurse, you are a doctor, I'm the boss, you are that. So I think if as a society, and sometimes I question myself, what are our values as Ghanaians? Can we clearly say that these are our values? Of course, we have cultural values about protecting this and that. But like the four I've mentioned here, clearly stated, it's cut across the societal, from the society, from the top to the down. So I don't care who you are, I will respect you. I don't need to know your level before I respect you. And I think if these are deeply ingrained in our society, it will transcend beyond the healthcare setting. People will respect each other, and we wouldn't have some of these basic things, people intruding in healthcare facilities and also among the multidisciplinary team fighting amongst ourselves. So I think we have a great consensus that going forward, we need to respect each other. Going forward, we need to also appreciate each other's point. Like Dr. Ackerson said, recognition is so important. It doesn't take much. Just by saying that, like the example you gave, he is the head, but this one runs the show. It comes with a sort of excitement, and people are able to work together harmoniously. So I think we have a lot to do with our healthcare system to avoid such future occurrences, ultimately to improve the health outcomes of our patient and also job satisfaction as well for us as healthcare professionals. So I want to believe I've summarized all that we've said, and I haven't been biased as a host in this regard. I want to thank you, Dr. Ackerson, who is actually a doctor. Currently, he was trained and also practiced in Ghana as a medical doctor, and currently he's working at Leeds General Infirmary. And we also have Mr. Emmanuel Prah, who also trained and practiced in Ghana, and currently he's a child nurse at the East Surrey Hospital here in the UK as well. Gentlemen, I thank you so much. Your final words, Emmanuel, in 1 minute, your final words.
Yeah, what I would like to say is, doctors and nurses, we are all one, irrespective of our trainees, irrespective of the duration of the length we spent in schools, irrespective of our scope of practice. We should see ourselves as one. And the ultimate thing is patient safety. If we start fighting against ourselves, if we don't work together, it is our patients who are going to suffer at the end. So let's see ourselves as a member of one team and work together in harmony. Yeah, thank you.
Thank you very much, Emmanuel. Dr. Ackerson? Go for it.
Yeah. So, basically, all that Iman has said. Let's as doctors and nurses, let's foster that. Sorry. For now, I think that in this particular incident at Minsha Hospital, there should be a bit more of team building activity for the doctors and nurses, so that this relationship that has been strained over the few days will be patched up nicely, and then work will get back on. So basically, doctors and nurses, like Ima said, oh please allow me. So doctors and nurses, we work together, and we've been doing this for a long time. We still maintain very cordial relationship with a lot of the nurses that work with us when we're in training back in Ghana. And some of us have gone ahead to have very personal relationships with nurses. And Precious, yourself, you have very personal relationship with doctors. So we shouldn't be fighting at all. Nurses and doctors, we are from the same mother. Yeah. Isn't it?
Amazing.
Yeah.
Thank you so much, gentlemen, for joining us. And we also want to thank Josephine Amwa for joining us live, of course, to share her thoughts We also had people like Irene Bosman, who was watching and has sent a number of messages. Prince Cheba also joined and sent a number of messages as well. We had a few other people who joined. Unfortunately, I'm not able to see your names, but we want to thank everyone who joined us today. And I want to thank you, gentlemen. Have a lovely evening and stay
Thank you, precious.
Yes.
All right. See you.
All right.
Life is a journey and sometimes can be a lonely road. When friends and loved ones forsake you, all you got to do is to be bold. I knew it years ago that those who undermined me had their minds undermined, but I never mind. They should keep on undermining because I'm a real good. I must undergo mining. Talking of mining, it leads to discovery. We mine to discover, we learn to discover, we observe to discover. Friends can uncover you at the same time discover you. But I don't want to discover you, I would rather discover more, so I go on the internet and I listen to words of wisdom and intellect. Availability of information, interviews of great men and women all over the diaspora and all nations. Creativity at its best, dexterity of research, no need to go through any formal education. I introduce you to the Discovery Show. Let your friends and your family know the struggles before the blow, their highs and their lows. Pay attention to this show, it will make you feel at ease. The Discovery Show on YouTube got the steez. Now Perry, the presenter, please pose for the camera. I want to hear you say cheese. We are airborne like a flu. I want to hear you sneeze. It's true. The Discovery Show is live on air, Instagram, Facebook, YouTube. See ya. TDS TV, Yearn to Learn. Host, Harry Precious. Executive Producer, James.